right, so we have Christine here. She came to see Dr. Davis for her knee pain. Tell me, how long have you had this knee pain?
About 6 months.
6 months. Have you tried doing anything to make it feel better?
Yeah, I've had what they just told me was some kind of a collagen shot. I've had 3 of those.
Okay, did it help you?
Yes.
For how long?
It's been 5 months and I haven't had it again.
Okay. All right, so we want to see where the movements are bothering you and
Okay.
to see what is causing you pain. So I'm going to have you to stand up. Any pain there getting up?
Oh, not really pain, more of a discomfort.
Where?
In my knee.
In your knee?
Yeah.
Okay. And you say you were around 6 of pain in your knee right now?
Yeah.
Okay. All right, so we're going to have you step forward a little bit and then make your feet wider and you're going to do a squat. So go as slow as you feel comfortable.
Okay.
Okay,
That's it.
that's fine. Yep. Any pain there?
Yes.
Where?
Right in here.
Right in front of the knee?
Yeah.
Okay. Now let's have you slowly go down the stairs. If you need to hold on. Okay, and then go up the stairs. How'd that feel?
It's all right. It's not comfortable.
Not comfortable. It's hard to get up. And
Yeah, it
I
is.
noticed that you can't use both legs. You have to always use one. You're leaning with one leg, so you can't do one at a time, right? It's too hard for you. So out of all the movements that we did, which one caused you more pain?
Probably the stairs.
The stairs? Okay. All right, you ready to start? Ready to go?
Yeah.
All right, let's do it.
Okay.
2,
You got it, Christine. Keep pulling, keep pulling, keep pulling.
5, 6, and 7. Good.
Deep breath and go down and out. 1, 2, toes out. 3, 4, 5, 6, 7. Excellent. Good job.
All right, Christine, we're going to have you walk down to the end of the hall and back for us. How's it feeling, Christine?
Not bad.
What changes have you noticed?
My knee doesn't seem to hurt as much when I walk.
Okay,
And that one, of course, is fine. So
right. But if that right knee is
my right
still...
knee seems to feel better.
Okay,
So now instead of grinding it, now we're having it go like this. It's opening up the joint a little bit better.
Okay.
That's why when you notice when you walk, you feel like I'm taking a little bit bigger stride than I normally would.
Yeah.
All right, Christine, just working out with Dr. Davis. How you feel? Beat up?
Yeah.
All right, so we're gonna try those movements again. So let me have you stand up. Oh, look at that, was smooth. That was
Yeah.
good. Feel a little bit easier to get up?
Yeah.
Awesome. Now have you step forward and then slowly give me that squat. Go as slow as you can. And okay, all right. Wow, that's awesome. Much better?
Yeah.
Yeah, a little bit faster, right?
Yeah. Yeah.
Awesome. All right, let's have you go down the stairs. Okay, and slowly go up. Moving smooth, moving good. All right, how'd that feel?
It was a little better.
It was better? Yeah. So you were at 6 at first. Where you at right now?
Like a 4 or 5, something like that.
Oh.
I didn't push going down the stairs because I'm used to not doing it.
Okay.
So, and I didn't push coming up because I don't want to go backwards. That's
Gotcha.
what's
Okay.
in my head.
All right. We're going to work on some therapies.
Did she do?
Yeah, she did great in the squat.